Hi everyone, this is our weekly blog, and I'm back from Berlin in one piece. I was there for 6 days, 4 days with mostly medical doctors, talking about post-diagnosis and, of course, DNA. And this method is growing rapidly in Europe. The gentleman that has the largest practice in Germany was in attendance along with most of his staff, medical staff. And it was very enjoyable meeting these people, I must say. Really nice. There were doctors from Estonia, Sweden, Norway, Germany, Austria, England, Spain. I'm not exactly sure. But anyway, it was an honor for me to be invited, and I'll be back there next year. And my next overseas visit will be in England, June 30th to July 3rd. I'm speaking at to Chinese medical practitioners in England. It's being held in London at the Orthopedic School of Medicine in London. So anyway, we have our weekly blog, and today we had our head resident, Kylene, here.
Hello.
Their new and improved hairdo. Looks great. With some questions. And I think we're going to follow up now with the previous blog, okay? So what do we want to talk about?
Okay, so today we have, last episode, we talked quite a bit about what's happening in the heart, anatomically, the hemodynamics, and then how that relates to the pulse that you're feeling. And today we want to question you about herbs. And so herbs that match, how do you fix something like a goo pulse, or how do you fix, if you can, something like mitral valve prolapse, regurgitation, cardiomyopathy?
Okay. First of all, those of you who have been following me over the years, you'll see that my herbal rendition for solving these pulse problems changes a little bit over time. And so I'll give you my latest version of what I do when people come in with these specific pulses. So the most obvious pulse of a heart problem is a scattered pulse, which can be called a dispersed pulse, or if it really is scattered, a dead fish pulse. And, you know, what would happen if the patient was sitting in front of me right now with that pulse? What would I give them? Well, I need to very strongly move the blood through their large vessels and the small vessels of their heart to try to take the blockage problem away. So I would use Zhui Fu Zhu Yutong, like 25%. And in my clinic, I use a formula called Stress 1, which you can get off the website. It's basically a combination of Shui Zhe, Zhui Fu Zhu Yutong, Ge Zhe Zhu Yutong.